All right, I'm going to go ahead and call the meeting to order. Please rise for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Can I get a moment of silence, please? All righty. First of all, I want to welcome everybody here, whether you're viewing outside or you're present. Start with roll call, and I'm going to start with Commissioner Kaz.
Here.
Commissioner Mike Smith here.
Here.
Here, Mike. Here. Here, all right. Vicki, it's nice to have you up here.
Thank you. I'm vaccinated.
You're official now. Okay, you're legal?
Official.
Okay, I don't think there was anything on public comment. So we'll move on. Administrative business. It's my privilege to be able to read a proclamation.
Julie from CASA is here, just so you know, to provide it to.
Okay. You want to let her? Does she want me to take it to her, or get it to her afterwards?
Afterwards.
Okay. Welcome. I'm going to take this off. We're far enough apart. Now, most of these people had their shots anyway. County of Leavenworth, Kansas proclamation. Whereas our children are our most valuable resources and will shape the future of our communities, and whereas the majority of child abuse and neglect occurs when people find themselves in stressful situations that are preventable, but without community resources and support, they don't know how to cope. And whereas child abuse and neglect not only directly harm children, but also increase the likelihood of criminal behavior, substance abuse, health problems such as heart disease and obesity, and risky behaviors such as smoking. And whereas child abuse and neglect is a community problem that can be reduced by making sure each family has the support of prevention programs created among social service agencies, schools, faith communities, civic organizations, law enforcement agencies, and the business community. And whereas together we can strengthen and support families in raising their children in safe, nurturing environment. Now, therefore, we, the Board of Leavenworth County Commissioners, do hereby proclaim April 2021 as National Child Abuse Prevention Month. In witness whereof I set my hand and have affixed the great seal of the County of Leavenworth, Kansas, this 7th day of April in the year 2021. Michael Smith, Chairman of Leavenworth County Commission. Excellent thing. Do we want to say?
Well, Jerry's here. Would you like? Is there anything you'd like to say, Jerry? Sure.
Yeah. Go on, here. Introduce yourself to everybody again.
A member of the staff of CASA and part of the Child Abuse Prevention Council. So, dual.
Thank you so very much for sharing that with our communities. We have done a lot of different activities for Child Abuse Prevention Month throughout the year, so we're really just trying to raise that awareness and share what we're doing and try and get the community involved. So I appreciate you guys bringing that to attention, and the blue lights look amazing. So thank you.
They do, don't they? We appreciate everything you do, too.
Do you have any fundraisers coming up?
We do, yes.
Right.
So our annual Night at the Races usually occurs in May. We will actually be moving it to September this year.
Okay.
I think the tentative date is the 17th, I believe.
Okay.
And then our superhero run is scheduled for August.
Okay.
Towards the end. I don't have the date memorized. And then we're actually looking at a new fundraiser. We're tentative for October, but those details will come out later.
Okay, so there's plenty of time to get
fun.
the word out.
Yeah.
It'll be in Atchison.
Yes, it'll be a good time. So.
Okay.
Great.
All right.
But
Thank you.
Thank you very much.
Anyone else? Thank you. Okay, under administrative business, Mark, you have anything?
No, sir.
All right. Okay, looking at the consent agenda, is there anything that needs to be looked at or taken off? If not, I'll entertain a motion.
I make a motion that we accept the consent agenda as presented.
Second?
Motion and second. Any more discussion on that? Seeing none, I'll start calling Mr. Cos.
Aye.
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 Aye. That's very good. Okay, formal board action. Consider a motion to contract to Net Standard Inc. for IT managed services and strategic advisory services. Welcome.
Good morning.
Morning.
Larry. I bring two contracts before the board this morning requesting your signature, the chairman. One is a 3-year contract for Vital IT Managed Services. The other is a 1-year contract for Strategic Advisory Services. The RBA has a summary of what the different services provided are, so I won't read those back to you. The 3-year contract for Vital IT Managed Services, both of these are unbudgeted. I have no funds for these. That is $50 per device, so the more devices we have, the more expensive it gets. It's a monthly fee. Currently, with the 103 devices that we have intended to enroll, it would be $61,800 per year. The contract number 2, the 1-year contract, is a flat rate of $28,320, which covers 96 hours of the strategic services advisory services. I'd be happy to answer any questions the commission might have.
Any questions, folks?
Just, Mr. Marlboro doesn't have it in his budget, so we would be covering this.
Commissioners, actually, this is an expenditure that once the funds are available, which should be in the next 30 days, that would be eligible under the American Recovery Plan.
Oh, okay.
As we harden our network against infiltration and also expand its ability and capabilities for remote distance work.
Okay, that was
Good.
Yep.
good enough.
Any other questions? If not, I'll recommend the motion.
I'll do it.
Okay, Vicki.
Motion to award contracts to Net Standard Incorporated to Vital IT Managed Services and Strategic Advisory Services, not to exceed.
If I might on that one, because we may enroll additional devices, that price could vary a little bit. So if we could just approve those, and if we have changes, we'll bring it back if it's significant.
So
Maybe 100,000.
So not to exceed 100,000.
Yes, that'd be great.
Not to exceed $100,000.
Second.
Motion and second. Discussion? All right, I'll call the roll. Commissioner Cos?
Aye.
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 Okay, passes. Thank you.
Would the chairman like to sign these contracts now, or should I give them to Becky and you sign them later?
How many you got there?
Just get me back in.
Yeah. I'll take care of them for you as soon as I get out of this.
Thank you very much.
Thank you.
Thank you, Larry.
Okay, the next item is consider a motion to engage ACI Boland Architects for services for Cushing Hospital design.
Oh, yeah. Morning.
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 We released a RFQ for firms to engage us with a list of questions that we had to start off with. We narrowed that from the 7 responding firms to 3 as a committee and sent follow-up questions to the 3 that we narrowed down as a committee, and as a group, we unanimously decided the best course of action to recommend ACI Boland as the firm we would like to engage. They have 40-plus projects in the Cushing building itself over the last 15 years. The familiarity with the areas of the buildings that have been abated or might have issues of abatement, as well as the familiarity with the building and the ability to hit the ground running with their designs so that we can keep our tight schedule and their planned schedule of pushing this design quickly through so we can get to a construction phase so that we can stop renting a building, were all contributing factors to our deciding on recommending ACI Boland to engage as our architectural firm for Cushing. Questions?
Questions? Mark, you have anything to add, Doug?
He answered everything that I would have asked.
Just that once we have them on board, they'll start meeting with staff at the Council on Aging to get their work going, but also we will schedule sit-downs with them and any of the outside entities that have expressed interest in the facility, just so they can start to get an idea of what footprint they might be interested in as well. So this is kind of the next step, and then this group will coordinate those other requests for space.
Mike, Jeff, Vicki?
I don't have anything. I know that this architectural firm, I've seen some of the work that they've done when I was on the Cushing Foundation board with some of the remodels and things that were done, and they do a really nice job of the planning and things for it. So,
Chairman, you ready for a motion?
Go right ahead, Mr. Doug.
All right, Mr. Chairman, I move that we authorize Buildings and Grounds to hire ACI Boland Architects for the design of the Cushing Medical Building for Council on Aging and other county entities.
Second. Go ahead, Mike. Second. Okay. Any more discussion on this? I'm glad to see this personally.
Yep.
Okay. Start the roll call. Mr. Cos?
Aye.
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 Aye. Aye. All righty. Very good.
Thank you, Commissioners.
You're welcome. We're going forward. Good job. Okay. Any presentations, discussion items, Mark, or anything like that? Additional public comment?
Just if the board has anything.
I'm sorry.
I only have.
Oh, just only if the board had anything.
Yeah, I was
Nothing on
going to
ours.
say. I'm just, I'll start, Vicki, do you have anything to start with?
Yeah, the Mental Health Task Force met yesterday via Zoom, and there's nothing new to report. We're still looking at, I think that one of the things that we're looking at is kind of adjusting and making changes to some of the requests that came before, because there's a lot of changes that have taken place legislatively over the past several months during this, this year's process. So there's a lot of additional funding that's being provided for mental health services at the state level. The state of Kansas has applied to be designated as for some federal funding for mental health services, and the Guidance Center to be designated as a site, and other organizations are also. Our providers would also be qualified for that funding, and it would reduce or eliminate the need to expand Medicaid for the state of Kansas. So that's one of the things that's going on, and several other things. So that's pretty much, the discussions have been whether or not that there's still the or for all or whatever for the Board of County Commissioners to consider the Cushing facility as for a crisis center, if that were something that we were interested in doing. But that just depends, because there might not be. And that was, I think, pretty much and we're looking at expanding or increasing the participation of the different school districts in providing behavioral health services, because the outcomes for the USD 453 have been phenomenal. The demand is exceeding the capacity at this point, but it's really been a successful program, and the outcomes are incredible.
Is that good?
That's it.
You good? Okay. Just one thing I'd pass on. I had the opportunity in the last couple of days to go down to BOCC and talk with the mayor down there and their city administrator and just see what's going on there. One thing that I wanted to do when I came on as county commissioner was to make sure I understood and got to be not just in my district, but everywhere's district. And I was pretty impressed on the growth that BOCC has. So I'm going to eventually reach out to Mike and Jeff and Vicki and areas that I may not know with their city managers or their mayors, whatever, and to set up just a visit just so I get a better idea on what's going on. And we sit up here and vote not just on the district I serve, but the district as a thing. And I found it very, very educational. Some things that I did not know positive, and some things that, of course, the board will probably look at down the line. But it was an excellent thing, and I know Doug is going to be visiting down in my district for a while, and just to see, I just think it's good education to be able to do that, because you don't know what you don't know. You may think you do, but there may be things out there, and that sure came to light the other day when I was down in Baser. So I want to make sure we help everybody in the county. So I just wanted to educate myself a little better, and I thought it served up pretty well. That's all I have to do.
It's amazing what a town like Baser can do without $25 million dumped into it.
Yeah, we talked about that. Anything else, Dave?
I have a council meeting there tonight.
Okay. Michael?
We had a work day, and we had approximately 15 folks show up, 2.5 truckloads
Excellent.
into the
Awesome.
dumpster, but there's still a lot to go.
Are you sore, Mike?
What's
Are
that?
you a little sore?
Yeah, I'm not as young as I used to be. And that went really well. So, and then the Economic Development Task Force, we met
Right.
last
Right.
Thursday, and we had some good information given, and
Yeah.
that process is continuing. Went to the Linwood City Council meeting and discussed their proposals on roads, and I told them that they should come from the board itself to us. So
Yeah.
we'll see what they
Yeah.
what they come up with. Also, tornado relief bill, Senate Bill 23, passed the Senate. It's sitting over in the House. We just need it to. All they really need is a motion to concur with the Senate, and it would go to the governor. So we're still hopeful that will happen. Tonganoxie rescinded their mask order effective midnight on the 14th. So that's the last community. What did Lansing?
Lansing
Yeah,
rescinded theirs,
Oh, okay.
yes.
Also,
Yeah.
And we're still waiting on FEMA funding, and Tonganoxie also moved ahead on the sewer lines.
and the water line too.
Yeah.
We hope.
And the water
Yep.
line. Oh, and the water line.
So there ought to be a lot of water out of the industrial park in Tonganoxie.
A lot going on. Okay. Anything else, Mike?
That's it.
Okay, Jeff?
We had the Easton City Council meeting Monday night, working on some things like cleaning the grade school up, working out the MOU for the roads and streets agreement with the county, stuff like that. That's about it.
Okay. Mark, did you have anything else?
Just might add that today is a vaccination clinic. It's open to walk-ins, and they're going until, I believe, 8 p.m. this evening.
Oh, okay.
So people can come in after work if they haven't been able to. But they believe that somewhere north of 50% of the population has had the vaccine that is eligible for it. Obviously, under 16, they're not giving the
Right.
vaccine. So.
Right.
And they have both Johnson & Johnson and Pfizer today.
Moderna and
Or Moderna,
and
rather. I'm
Johnson
sorry.
& Johnson
Moderna and Johnson & Johnson
is available
today.
if somebody asks for it.
Right.
It would be available.
First come, first serve.
Okay.
It's from 10 to 8 today.
Yes. Yep.
Riverfront.
Riverfront Community
Yep.
Center.
Excellent hours. Anything else, Mark?
And the VA has been offering daily clinics, so there, I think that's why we're pretty confident that we're over 50% vaccinated, plus another 25% that under 16 years of age, probably. That's
Yeah, they have a big old sign when you go down Fourth. It's
And we have, all the pharmacies have it available.
Pharmacies
in the
have it
county.
available, doctors' offices have
Yeah,
it available,
so-
so definitely is out there for the people who are going to get it. They've probably had the opportunity. to
Yeah.
get it.
That's excellent. Anything else, Mark?
No.
Okay. Anybody else? I know we got a 10:45. We got a work session to discuss special use permits versus rezoning, cross assessments, and acre lots. If there's nothing else, then I'll take a motion.
Motion to adjourn?
Second.
Motion and second to adjourn. Mr. Collins?
Fastest meeting
Aye.
ever.
Aye.
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 Mayor Bernard taught me well, Jeff. Okay. The late mayor. All right. We'll see you all at 10:45. Thank you.